Hi to Miss Ivy and Sir Vengata. My name is Runa Chahamintrasli. Today my group will present about the lumbar side flexor and I will talk about the introduction. So the vertebral column is capable of the flexion, extension, lateral flexion and also rotation. Bending of the vertebral column to the right or left from the neutral position is lumbar side flexion. And returning to the erect position from the lumbar side flexion is the lateral extension. So the lumbar side flexion is thought to be a combination of the side bending and also rotation. Normally, side bending is attributed to the one-sided contraction of the oblique, the transverse abdominis, and also quadratus lumborum. So next, I will talk about the quadratus lumborum muscle. So quadratus lumborum muscle is the deepest abdominal muscle. It's actually located at your lower back on either side of the lumbar spine. It starts at your lowest rib and also end at your top of your pelvis. It's common to have pain here because of we use this muscle to sitting, to walking, and also standing. Next, I will talk about the origin, insertion, innervation, action, and also nerve. So, origin for the quadratus lumborum is iliolumbar ligament and internal lip of posterior iliac crest. For insertion is 12 ribs on each side of the rib cage. Quadratus lumborum insert or attach to the transverse process of several lumbar vertebrae. For innervation, the quadratus lumborum muscle is innervated by the subcostal nerve and the first three nerves of the lumbar plexus. So next is action, which is lateral flexion of vertebral column with ipsilateral contraction and also extension of the lumbar vertebral column with bilateral contraction. Fix the 12 rib during the first expression. So next, I will talk about the nerve, which is nerve at the quadratus lumborum is subcostal nerve, branches from the ventral rami. Okay, so next, I will talk about how to palpate the quadratus lumborum. So, patient position must be in front lying, then therapist position must stand at the patient side and facing the spine. After that, locate the lumbar spinous process with the fingertips, both of your hands. Then slide your fingertips laterally to the opposite side, past the laminar groove and the erector spinal muscle. Then you need to hook your finger slightly, pulling the erector back toward the spine as you palpate deeply between the 12 rib and ilium to find the angle fibers of the quadratus lumborum. So you need to instruct the patient to gently elevate the hip superiorly to assure the proper location. So I will show you the example of the palpation for quadratus lumborum. So this is how the palpation of the quadratus lumborum. So next, I will talk about how to improve your quadratus lumborum. So the quadratus lumborum is your deepest abdominal muscle and found in your lower back between the top of your pelvis and your lowest rib. So the quadratus lumborum support your good posture and help to stabilize your spine when you bend to side or extend your lower back. So working some of the quadratus lumborum stretch in your fitness routine can improve the flexibility in your back and relieve old arch and pain to reveal the new one. So I have a lot of exercise actually, but I choose gate pose and side stretch to improve your quadratus lumborum. That's all for me.
Hello, Miss Ivy and Sir Bengat. Today I will present about internal and external oblique. We start first with the internal oblique. Internal means inside. Obliques come from the Latin words obliquus, which means a slanting or rotation. The slanting direction refers to the direction of the fibers of this muscle. The fiber direction of the internal oblique is in the direction of reaching across your body. As in, if you place your hand on the opposite side of your abdomen, your fingers represent to the direction of the fibers. The next one is the internal oblique. External means outside. Oblique means slanting or rotation and refers to the muscle fiber direction. The fiber direction of these muscles is like the direction of reaching into your pockets. The internal obliques originate on the inguinal ligament, a ligament that runs from the anterior iliac spine to the pubic bone and the anterior iliac crest. The internal obliques originate on the lower ad ribs. The internal obliques insert onto the costal cartilage of the lower foreribs and abdominal aponeurosis, a superficial sheet of connective tissue over the abdomen, and the linea alba. The linea alba is a fibrous band of connective tissue that runs from the xiphoid process to the pubic symphysis. The external obliques insert onto the abdominal aponeurosis, the linea alba, and the iliac crest, and the pubic bone. Stabilization is a key function. The internal obliques function bilaterally, that means both sides, that flex the trunk and compress its contents. They function unilaterally, one-sided, to laterally flex the trunk and rotate it to the same side. The external obliques function bilaterally to flex the trunk and compress its contents. They function unilaterally to laterally flex the trunk and rotate the trunk to the opposite side. That's all from me. Thank you.
Assalamualaikum and good morning to everyone. My name is Nurul Hayati binti Rizwan, and for this side lumbar flexor, we'll talk about iliocastales lumbarum muscle. The iliocastales originate from the sacrum, erectus spinae aponeurosis, and iliac crest. The iliocastales lumbarum has the lumbar part, where its insertion is in the 12 to 7 ribs. The origin for this muscle at the ilium and insertion of the muscle at the rib. The innervation of iliocastales lumbarum is dorsal rami of the spinal nerve. Action of the iliocastales lumbarum muscle has two, which is bilateral action, which extend lower vertebral column at back, and unilateral action, which lateral flex cervical neck vertebra. How to palpate this iliocastales lumbarum muscle is, first, the patient must be in prone lying, so the muscles are relaxed. Then place finger on the erectus spinal group muscle. Flat the shoulder, reach toward with the upper limb, and then extend the spine. With ankle muscle activity, increase the contraction of the erectus spinal muscle by asking the patient to hold while you gently try to push the upper body toward the support surface. Conclusion for this side lumbar flexor, performing exercise toward the core muscle can prevent injury, increase stability, improve stability, and can pay attention to the posture. That's all from us. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Irina Sofia binti Muhammad Razman, and today I will share you about intertransversary muscle. So intertransversary muscle are the muscle that can be found at the transverse process of cervical, lumbar, and some thoracic. So the function is still not completely clear, but because of it's not the prime muscle, but it helps the prime muscle to make some movement. So intertransversary muscle was divided into two. There are lateral one and the medial one. So the insertion of the lateral one is transverse process of succeeding, while the medial one is primarily process of succeeding. So the action is to stabilize the spine, lateral flexion of the trunk. So the innervation is anterior rami of the spinal nerve, and then the blood supply is the dorsal branches of the lumbar arteries. So now I will show you the intertransversary muscle picture. So this is the transverse process, and this is the lateral intertransversary. So this is the medial one, here, and here, and here. So this is the lateral one, and this is the medial one. So lastly is palpate. So place your hand like this at the spine. So this is the lateral intertransversary, while like this, like this. This is medial intertransversary. You probably can palpate it because of it was a deep muscle. So thank you.
Hello to everyone, my name is Nur Hafizah Nadira binti Azman. So today I would like to present you about the longissimus thoracis muscle and the spinalis muscle. For longissimus thoracis muscle, it is the largest muscle in the erector spine, and it is originating from the transverse process of the lumbar vertebra, which is from the lumbar 1 and until the lumbar 5. The insertion of this muscle is at the transverse process of the thoracic vertebra, which is from the thoracic 1 until the thoracic 12. The innervation of this muscle is at the lateral branches of the posterior rami of the spinal nerve. How to palpate this muscle? First, position the patient in the prone lying and then standing at the side of the patient and locate the spinous process of the thoracic vertebra with the fingertips. After that, you have to slide laterally past the lamina groove onto the erector spinal muscles and then shrunk back and forth across the erector spinal muscles. After that, you have to ask the patient gently lift the head and extend the trunk to ensure the proper location. For the spinalis muscle, there are three muscles, which is the spinalis capitis, spinalis cervicis, and the spinalis thoracis. This muscle assists in the extension and the lateral flexion and also the rotation of the spine. The spinalis capitis and the spinalis cervicis originate from the spinous process of the cervical 7 until the thoracic 1 vertebra, which while the thoracic muscle, it is originating from the spinous process of the thoracic 11 until the lumbar 2. The insertion of the capitis is at the midline of the occipital bone, the cervicis at the spinous process of the cervical 2 while until the cervical 4 vertebra, while the thoracic muscle at the spinous process of the thoracic 2 until the thoracic 8 vertebra. The innervation is at the lateral branches of posterior rami of spinal nerves. How to palpate this muscle? First, position the patient in the prone lying, and after that, you have to stand at the side of the patient and place finger on the erector spine muscle group. After that, you have to ask the patient flex the shoulder and extend the trunk. Lift the upper body with the shoulder extended to activate the latissimus dorsi and mask the erector spinal muscle. With unclear activity, increase the contraction of the erector spinae by asking the patient to hold in the position while you gently push the upper body towards the support surface. So that's all from me. Thank you.
Solution for this side lumbar flexor. Performing exercise toward the core muscle can prevent injury, increase stability, improve stability, and can pay attention to the posture. That's all from us. Thank you.